Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy, and we are going to cover the topic that is sagittal plane. Okay, so if you remember, till our last session we discussed what are the body planes, how many types of body planes are there, right? Now this session is in the continuation of the same, where we are going to talk about each and every plane one by one. So firstly, in this session we will focus on sagittal plane, then next plane, and then next plane. Okay, so we will proceed in the same way. Like firstly, I'll explain you what is sagittal plane. We'll walk through some of the definitions, the word meaning, like we will find out what is the meaning of this word sagittal, right? And also I'll share you the interview questions and interview questions, as well as the tricks that will help you to prepare well for your interviews and examination. Okay, but before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being we are just mainly focusing on what is sagittal plane, but prior to that you should know what are body planes. Okay, if you know these kind of things, then things would be very easy for you. Now for that, what you can do, you can refer the Sharmit digital course book, which is freely available for all of you in the description, where you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content. And in case if you have any questions related to that, you can simply reach out to me through comment section. I would be more than happy to answer all your questions there. Okay, alright, so let's get started with the sagittal plane. And for that, you can also clearly see this image and try to keep this image in your mind when we are going through the notes, because it will help you to understand what is sagittal plane. So in case of sagittal plane, this is the imaginary disc that you can assume, or a slice that you can assume is passing through the body in this way. Okay, in the midline. Okay, it is passing from front to back in a midline. Okay, so this is the sagittal plane. Now when I will walk you through the definition, it will give you more clarity, like how we are assuming this slice. But just remember this diagram, okay, and let's see how it goes. So definition is quite simple. You can say that sagittal plane is a vertical plane that runs from the front to back, that is anterior to posterior. Now I'm assuming that you know about anterior and posterior, because that we have already covered. Okay, through the body, dividing it into the right and left portion. Sagittal plane, a vertical front to back plane that divides the body into right and left sections. Okay, so this is the conclusion. Now, some of you might be thinking, what is the meaning of sagittal? So the word sagittal comes from the Latin word that is sagitta, means arrow. Okay, so this name refers to the sagittal suture of the skull, the line where the two parietal bones meet up at the top of the head. Okay, and this suture runs in the front to back direction, similar to the path of an arrow would take if it shot through the body from the front to back. So what basically it is meaning, like it means arrow. So now you can assume that one arrow is passed through the body, okay, shot through the straight body. So what it will do, it will pass like this. Okay, so we can assume that it's a kind of area that impacted by the arrow. Okay, just an imagination. Okay, so this is called sagittal plane. Now we know that sagittal plane divide two things. Now what are those two things? The sagittal plane divides the body into two parts. One is the right portion and one is left portion. Okay, and this division relates directly to the directional term medial and lateral. Okay, so that's why, like, we were learning about those directional term. So medial and lateral is something that you can directly relate with these division. And we can say that the structure closer to the sagittal plane are medial, and the structure farther from it are lateral. Mainly we have two types of sagittal plane subparts, but before that you should know like what we are talking about. Left part. Okay, so this is midline, right? We know that this is the medial area. So if something is near this medial area, it is called as medial, and if it is far from that, then we will consider it as a lateral. Clear? Now we will understand what are the types of sagittal plane. Okay, not the body plane. Now we are talking about the subtypes that are sagittal plane. So there are two specific types of sagittal plane based on where the cut is made. The first is mid-sagittal plane, that is median plane. This is the sagittal plane that passes through the exact midline of the body. It divides the body into two equal halves, a right half and a left half, that are mirror images of each other. It passes through central structure like the nose, sternum, spine, umbilicus, and this is the only sagittal plane that produces the equal left and right portion. Mid-sagittal plane means the exact center sagittal cut producing two equal halves. So you can see this diagram is of mid-sagittal only. Okay, why? Because it is dividing the body into two equal halves, equal left portion and equal right portion. But if the same disc is passed through, let's say from here, from the shoulder, then it is a different, that is parasagittal plane. Okay, so if it is passing through the midline and dividing the body into two equal halves, then we will call it as a sagittal plane, mid-sagittal plane. Otherwise we will call it as a parasagittal plane. Okay, so it depends on the disease or the kind of examination that experts are performing. According to that they select. Let's say if we want more closer view of this shoulder related area, so we will take it parasagittal plane, otherwise mid-sagittal plane. Clear? So I think this part is clear. Now you can see here we have already mentioned parasagittal plane. So this is any sagittal plane that is not exactly on the midline. Okay, so if the plane is not on the midline, we will consider it as a parasagittal plane. Okay, it is off center, running parallel to the mid-sagittal plane but to one side. It divides the body into unequal right and left portion. The prefix para means beside or next to. So parasagittal means beside the sagittal midline plane. So parasagittal plane is any off center sagittal cut producing the unequal left and right portion. Now let's say if someone in interview asks you to compare these two things, so you can compare it easily with these features. So feature first says location of cut, that means exact midline. So in mid-sagittal plane, location of cut is exact midline, and in parasagittal plane, location of cut is off center to one side. If we talk about the portion created, it creates two equal halves. Mid-sagittal create two equal halves, and parasagittal create two unequal portion. Okay, mid-sagittal is also called as median plane, and it is also called as off-center sagittal plane. So sometime in an interview they might ask you directly with this name, off-center sagittal plane. What is off-center sagittal plane? So you should know about this alternate name and you can explain parasagittal plane. Similarly they can ask you median plane. Okay, now these are the example. If we talk about example, so it cut directly through the nose and spine, cut through one eye off to the side of the nose. Okay, now let's see what are the structures located on the mid-sagittal plane. So the mid-sagittal plane runs through the exact center of the body. It passes through the midline structure like nose, mouth, sternum, belly button, vertebral column, linea alba, and pubic symphysis. So these are the same structure that were identified as medial structure in the directional term notes when we were learning that part. And this is the direct link between the sagittal plane and the term medial. Now let's see how it is utilized in medical coding and medical science. So you can see there are some terms that I have noted down along with their meaning. The first one is sagittal MRI. Yes, an MRI image is taken in sagittal plane showing the side view. Then we have mid-sagittal section, which means a precise central cut dividing the body into two equal halves. Then we have parasagittal section, an off-center cut dividing the body into unequal halves. Then we have sagittal suture, that means the skull suture between the parietal bone and running through the running front to back. Then we have sagittal split osteotomy, a jaw surgery procedure involving a sagittal oriented bone cut. Then we have sagittal balance spine, the front to back alignment of the spine assessed in the sagittal plane. And the last one is parasagittal meningioma, which is nothing but a brain tumor located near the midline of the body, but not the exactly. Okay. Not midline of the body, it's midline of the brain. So these are the just example that instruct us like how sagittal word is used with the terms. Okay. Now we have learned about so many things. So how we are going to remember it? So there is some trick that will help you to remember it. Sagitta means arrow. So imagine a arrow shot straight through the body from the front to back. Now an arrow flying through your chest from the belly button toward your spine travels in the sagittal direction. The imaginary arrow path creates the sagittal plane, splitting the body into left and right. Now another way to remember is sagittal means side view or left or right division. Okay, so in this case left or right division is performed just to visualize the side view. Okay, so I think this is clear. Now I have one question for all of you, and today's question is a bit tricky. I'm sure you already know the answer of this question, but the question is, what is MPR? So please do share your knowledge in the comment section so that others can take a reference from it, and also it will help you to recall your topics. Okay, so that if someone is not even know the answer, they can simply look at the comment section. It will help other to understand this thing. Also, like when you are writing the answers, it will instruct me that you guys are learning from these sessions, and accordingly I will release the more sessions for this playlist. Okay, so yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.